Hello, everyone, and welcome to this audio podcast. This is another RPSG and KDOS collaborative. It's an audio podcast as part of the Illmatix series. This is a audio podcast um, where there'll be an overview, a sort of an overview surrounding public health perspective, a public health perspective on peer support. This is another Storm Robotics, and uh, public health is defined as the art of science of preventing disease, prolonging life, and promoting health through the organized efforts in and around society. Um, there's works and there's documentation on and evidence in surrounding sort of a basis around public health by the World Health Organization, which that had been published in 2018. Public health supports individuals, organizations, and society to tackle, challenge, prevent, to and society to sort of tackle and challenge disparities, and sort of in doing in the sort of approach is sort of threefold, really, and that is number one. There's prevention, where there's where related to prevention, is from public health perspective, it's reducing the incidence of ill health, supporting healthier lifestyle approaches. Number two is around protection, where surveillance and monitoring of infectious disease and emergency response, and immunization, and promotion, which surrounds health education and assigning services to meet specific health requirements. Generally, also, as a sort of visual, if you like, public health surrounds sort of surveillance, monitoring, analysis, looking at incidences and prevalences in and around in and around epidemiology, and surrounds epidemics, and disease prevention. Looks at how to sort of how to ensure that in and around aspects of public health, in the public domain, that is important, where particular aspects of public health are communicated. Public health also looks at sort of the risk, sort of risk and causations around particular aspects of healthcare, health and disease, and also in and around aspects of research or health research, but also health promotion as well. Um, in context of support in healthcare, support is an ongoing, is a sort of ongoing and a way of a way to manage aspects of health, and people need, or people generally need a sort of a sort of a holistic approach to manage and maintain health through practical and social, practical health, to manage health through pragmatic modalities, and support in healthcare also creates a constant attitude change for people with chronic through chronic with particular conditions, and and although access to healthcare is an obvious and an important factor. The debilitating or the debilitating aspect around this is of people being able um, to not just access care, but to ensure that in and around healthcare that there is a sense of continuum as well. Ample evidence or literature and evidence generally suggests that without support, people are not a are not feel can feel can feel unequipped to manage their conditions, which could be could lead to poor healthcare outcomes and other sort of implications as well. And therein comes a sense of connection that correlates and affiliates one public health um, with with healthcare through sort of through various sort of through healthcare through and in between different healthcare sectors. And the connection can be viewed as quite sort of holistic in some regard, and built on sort of experiences where people get to be um, uh, um, sort of involved in aspects of their healthcare. And again, in and around the literature around aspects of healthcare, um, there at least in and around public health, there is some evidence to indicate that um, uh, a sort of a patient and public involvement approach in healthcare, in aspects of healthcare, does have has some bases has some bases, but also some advantages. So in and around this sort of overview, the aim is to sort of provide an understanding of how public health sort of interrelates in and around peer support, um, um, and in and around peer support. And so and around this, for example, there is uh, uh, there's one or two main particular questions. So, for example, how does peer support how does peer support help, or how can it help? Why is it necessary in context of public health? And also in and around this, there's bases around there'll be some bases in around strategic thinking and challenges, and an example of mentoring during end stage renal disease, or ESRD, and advantages and disadvantages of peer support as well. So the first question here is how does peer support or how can peer support help? So there are several sort of self-management sort of interventions that have been evidenced, that include lay people, and the people lay people, for example, the people who with for example lived experiences, um, uh, um, uh, um, who wherein lived experiences can help both healthcare professionals understand what's required in aspects of healthcare, but also other patients with who are, for example, new into aspects of a particular diseases or conditions. And there's works by Lawn and Shu from 2011 that look at some aspects in relating to this. Excuse me. Lay people and sort of lay people and those who have been involved in in sort of aspects pertaining to peer support have apart from sort of that sort of experienced and understanding around particular conditions, for example, can help deliver support, treatment, and preemptive services. Help in align to align can help and align sort of aspects of patient care, if you like, with treatment and and support patient care in aligned to particular healthcare services, so that's to sort of preempt sort of where patients who, for example, are new into particular conditions or diseases or for example, can actually can provide sort of peer support and align to this as well. This in align to peer support, perhaps aligned to peer support more specifically. The preempt aspect or the preemptive aspect, wherein, for example, where patients, where there may be patients who are new to a disease or conditions, for example, the preemptive aspects and around peer support is important, because this can actually bring a sort of a sort of a way of integrative sort of integrative practice into sort of disease sort of education, if you like. And while current systems of healthcare delivery has developed or have developed over time as well, non-professional community members with lived experiences, for example, will still remain an important substitution for professional healthcare providers in some regard as well. And there's works by Simeone and team in 2011 that look at that. There's works by Simeone and team in 2011 where Simeone and team in 2011 highlight that 5 methods of peer support have been identified to include, for example, one-to-one or one-on-one sort of peer support, face-to-face peer support, one-on-one telephone peer support, group face-to-face peer support, and group telephone and group internet or online sort of peer support, and the works by Simone and team in 2011 were also were sort of a follow-up works, if you like, by works by Hoey and team in 2008. And although through many sort of disease groups, peers often work in person or over a telephone, for example. Um, with advancements in the way certain aspects of healthcare are delivered, there have been sort of more there have been inventive sort of ways in supporting particular disease populations. So, for example, apart from some of the ways that peer support sort of have been documented and highlighted, um, there have um, there have also been modalities such as email chat rooms and websites, and sort of social media links that have been sort of have been as part of the interplay in aspects of peer support and healthcare, in both sort of directly and indirectly. And so activities that are simulated and have a sort of peer support and aspects surrounding involvement generally uh, uh, have 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 sort of a high there's a high probability sort of high probability of sort of sort of success in ensuring that sort of patients who are new to particular conditions or diseases can 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 actually do can and do actually sort of get the best out of healthcare by ensuring that the by ensuring that dialogue with health professionals and patients with similar conditions or similar lived experiences, for example, are used can be used and can be used sort of advantageously. Um, so in line to peer support, I'd like to sort of highlight some context of peer support in around in around sort of in around sort of public sort of a public health perspective here. So to begin here, the question is, why is peer support required in context of public health? So generally, there's works by Salis and team that go back to sort of go back to sort of almost in the late in and around 2008, and the basis of peer support has been sort of depicted as where there's sort of a sort of so for example, where there's a patient-centered perspective and aligned to sort of where initially where initially it's important that at individual level that patients get or are receiving the appropriate aspects in and around their healthcare, and then thereafter it's then been depicted and highlighted that family and friends and sort of those who are close around the patient around the patients are have an understanding in and around aspects of in and around aspects of public health and conditions or disease, albeit and then thereafter wherein after sort of after after those sort of after those sorts of set those sort of those base that basis or bases, it's important then to ensure that there's a sort of a sort of a documented a documented way wherein in and around aspects of public health, and then the in around particular diseases and conditions that the system that particular system or within a system and culture, system and aspects of culture have have an understanding or sort of a sense of view in and around that disease and condition, and in and around public health, and then thereafter thereafter sort of sort of where at policy level, if you like, and then sort of where there's a link between sort of policy and community, if you like. So in and around this, there's in works by again by Salis Salis and team in 2008. They look at there's works by the team that look at sort of peer support in context of a socio-ecological model, and peer support can be viewed as almost as a strategy that enhances an individual's behavior across different perspectives, and effective sort of effective effective sort of modalities, if you like, in and around different aspects that align to public health and sort of disease or condition. For example, enable individuals and patients to self sort of self manage or and navigate conditions, and help and, and sort of help within health, help in aligned to where other patients and other where other patients and who are, for example, again new to condition or disease pathway, can help in context of healthcare. And with careful variation, peer support models recognize sort of a favorable excuse me, recognize or prompt a favorable inclusion aspect to public health, and due to severity in sort of resource constraints, in resource constraints in some aspects. Um, they're they're still they're generally there there has not uh, uh, been sort of frameworks or documented works where there's a link between sort of peer support sort of at sort of, let's say, at national level, um, and thus peer support generally is sort of a although it's an old it's kind of it's an old it has an old basis. It's one of those basic bases that peer support through through sort of more inventive ways. Peer support can bring together support required to bridge particular aspects of healthcare, so that patients and health professionals where both patients and professionals are co-developing sort of aspects of sort of um, prospective care, where appropriate and where needed. um, the socio-ecological model has a sort of a sort of a depth basis as well. There's works that has actually been that stems from the Centers for Disease Control and Prevention, the CDC, and is there was a there has been a documented socio-ecological model and a framework for prevention, and it is available through the Centers for Disease and Control, the CDC. Is published in it was published in before 2018. However, the socio-ecological model can be defined where there's sort of a basis around behavior change, or behavior change communication, then behavior change communication and social change communication, and then social change where social change communication leads into aspects of social mobilization, and then ultimately where advocacy thereafter follows, and um, in relating to the socio-ecological model, if you like, there is basis around sort of around how there is a basis of how the socio-ecological model can be sort of implemented through and through sort of interpreting different aspects of the particular model. For example, in relating to behavior change communication, the main features around that, for example, according to the socio-ecological model, is that it focuses on individual knowledge, attitudes, motivations, self-efficacy, skills building, and behavior change, alongside interpersonal communication, and aspects in relating to social and in relating to social media. In relating to social change communication, the socio-ecological model looks at interacting groups in a participatory process to define need rights and collaborate to reform aspects of of uh, uh, of care system, and this then also as part of the social change communication aspect of the model of the socio ecological model. Interpersonal communication, again, alongside social media, has a part of the basis as well. In relating social mobilization, uniting partners at national and community level is important, or has been important. And then advocacy, where policy environment, and develop policy environment, or assessing sort of policy and environment alongside other aspects, and then are important. And then where wherein wherein then as part of advocacies, is generally been documented as um, a sort of where a pathway can be developed to sort of develop and change particular laws, wherein that is applicable. And of course, apart from the different approaches according to the ecological model, there's the main features, and then there's the participant groups. And so behavior change communication, has bases around individuals, families, or households, small groups, small groups. And then social change communication surrounds groups and individuals in communities. Social mobilization, it relates to national and community leaders, and community groups. And then policymakers, decision makers, program implementers, and community leaders form sort of the participatory group in around advocacy. So the more the sort of in-depth sort of interpretation around the socio-ecological model can be identified by works that have been published by Schaffner Rogers in 2013, in works a regional communication strategy development guide in newborn care and the prevention and the control of childhood pneumonia, and it was published as part of a resource aligned to UNICEF in 2013. In around this as well, there's around in and around peer support, or peer support and sort of public health. There is there is a sort of a strategic there's a sort of strategic thinking and challenges. And in this there are four main sort of four particular paradoxes, if you like. So there's peer support, there's peer supporters, then there's sort of a target population, and then there's sort of there's an entity around at organization level. And then there are as part of the as part of peer support, the strategic aspect, there is then the sort of challenges aspect, that are formed in this as well. Um, Now, in regards to in regards to um, uh, in regards to renal replacement therapy, for example, and kidney disease or end-stage renal disease, um, there is works by Taylor and team in 2015 where they look at um, where they implemented the principles of grounded theory through coding, and four categories, or four sort of categories had been identified wherein there was perceived benefits of peer support over other sources of support. Then there was peer support, something that's been referred to as peer support occasion, and then there's permission to interact, and the care category, and another and the other element is something that's been referred to as the sort of peer relationship aspect as well. Now, in Taylor, in works by Taylor and team in 2015, um, they the sort of definitions, or the basis around all of these particular sort of categories or themes, if you like, um, can and were in some way triangulated. So, for example, perceived benefits of peer support over other sources of peer support included in had a basis where there was um, there was involvement of patients and carers in similar situations. Feelings There was feelings of where there was a sense of more control, and a value of learning about the future and course of condition and treatment, and related encounters within sort of the nephrology setting, and also informal peer support experience as well. In and around peer support occasion, there's a basis where um, there's a sort of a willingness to be able to interact with peers on occasion when a sort of the peer support occasion aspect also had a basis in around the appropriateness of of sort of peer support. There was a basis in and around wherein wherein there was wherein there was a basis around uncertainties, and also aspects of attitude and behavior, and also a basis around sort of having sort of access almost to peer support, in and when initially told or informed about a CKD, a chronic kidney disease diagnosis. And also, so around sort of permission to interact as part of the care category. Um, the basis surrounding perceptions of being needy or lacking resources, where there can be challenge to self-esteem. There can be professional but inflexible. It can be judged as cold and sort of unapproachable or unfriendly, um, only for people with serious illness, like needing Samaritans or Alcoholics Anonymous. And could also promote a sense of exclusion and stigma, and peer support role. The peer support role itself within this particular paradigm, um, would also, as part of that particular paradigm, would need explanation of wherein for example cohorts would sort of fit into that particular category. And then the category around sort of peer relationship, for example, um, peer supporters trained to be good listeners. There's a sense of building a rapport, and then there's a resistance to the notion of being a passive recipient. And uh, and uh, in works by Taylor and team in 2015, it was have been highlighted that interviewees in their works felt unequal exchange might generate uneasy support, a sense of uneasy support. Um, and so um, the idea of peer support also, and sort of had been documented in works by Taylor and team in 2015. Um, uh, Generally, peer support can be identified as an opportunity to have sort of to have sort of peer support in different ways. One to one being one of the main ones, and excuse me, and where it's an opportunity to have communication with individuals, health professionals, as well as patients with lived experiences, um, uh, uh, and also where um, practical and a practical and sort of a support, or pragmatic support, is based on communication, on sort of communication based in and around sort of particular aspects of lived experience, um, and generally available to all patients, with all CKD patients, at least in the works that had been published in works by Taylor and team in 2015, um, uh, uh, available to CKD patients. There was a base there was an understanding where peer support it had a basis around where individuals or patients with lived experiences were lived experiences, as well as health professionals, were able to or should be able to and are able to are able to and should be able to look at aspects that relate to for example, disease causation and diagnosis, um, and making choices about treatment and therapy, and considering whether to go, for example, considering whether to go onto one form of renal replacement therapy versus another, when considering whether and considering other aspects that align to sort of the particular health health condition, and sort of the disease pathway, and corresponding to care and education also received between patients and health professionals was is has been documented as as a basis of peer support as well, provided provided um, by patients and carers, but at the same time, where health professionals, at least in more recent literature, is important, and also also pivotal, because in patients and professionals, being sort of involved, it brings a sense of camaraderie, in aspects of healthcare, but also in meeting particular mutual objectives, where ultimately where ultimately it's to ensure the patient is able to survive aspects of condition. Um, in documented works, peer support, retrospectively, has or has been documented, where it's often provided by sort of volunteers. Volunteers and volunteers in aspects of healthcare relate to patients and carers, for example, who have sort of undergone particular particular checks, after training, for peer support based roles. However, um, if uh, if we look at if listeners look at literature, if listeners look at literature now, um, peer support generally, um, uh, is a sort of a paradox, and a basis where, for example, where both health professionals and patients, um, um, for example, so apart from lived experience, for example, the lived experience aspect forms a basis for patients and carers, for example, who want to provide new patients, for example, an understanding, but that lived experience forms a basis around the evidence, or sort of an evidence, in context of where, for example, um, uh, if and where patients and carers have not gone through particular checks to provide and share understanding and experience, the lived experience, on its own, um, for new patients, uh, is and should be implemented as advantageous, as advantageous um, and in literature now, there is there's more documented works that regard sort of peer support in various modalities as well. And so peer support or peer supporters in works by Taylor and team in 2015, but also sort of beforehand as well. Peer supporters have been identified and sort of recruited through posters and care forums and at least in the United Kingdom through, for example, patient-based organizations or associations and sort of and networks in that regard as well, and also where, for example, where health professionals, for example, where health professionals on behalf of those who are experienced can sort of provide letters as a way for patients to new patients to be approached if and where applicable, and and also in works by Taylor and team in 2015, there's been sort of aspects in relating to peer support and health services or healthcare services, wherein there's in particular specialisms around healthcare, there was or there has been sort of network clinical champions and sort of dedicated health professionals between different hospitals, for example, or National Health Service trusts, aligned to aspects of peer support, and peer supporters are generally sort of accessible after being referred, or where there's a sense of referral by health professionals if applicable, at least in works that have been documented by Taylor and team in 2015. In and around of the advantages and disadvantages of peer support, there's works by Bennett and team in 2018, which so some of the advantages, for example, can include, for example, there's where support is provided where it's can be less clinical. There can be sort of an advantage in and around where with and in amongst patients, and in amongst patients from ethnic minority backgrounds. There can be sort of advantages around peer support, to help sort of bring a sense of camaraderie, in and around peer support, uh, um, in that way, as well. And peer support as an advantage. Another advantage can be, for example, where there can be a sort of where patients and carers, where they may feel a sense of abnormality. Peer support can bring a sense of normality, into aspects of healthcare, and um, another advantage, for example, it can be advantageous for both mentors, the peer supporter, and the peer supportee, and the advantage also then stems into a sense of authenticity, in and around aspects of care, and uh, peer support also, as an advantage, allows the sharing of knowledge and experience, a sharing of common goals, practical skills transfer, which can be transferable. For example, in context of renal replacement therapy or nephrology, generally one of the common things is where patients may have to be on different forms of, apart from being on different forms of renal replacement therapy, one of the more sort of common forms of renal replacement therapy is hemodialysis. And the sort of discussions, one of the sort of common discussions that come out from sort of things, from sort of aspects in relating to sort of peer support, and in relating to peer support and in relating to hemodialysis, for example, is where new patients can have anxieties around self cannulation or cannulating, where sort of self cannulating after being trained after being trained by health professionals, for example. And so, um, uh, as a sort of a practical and transferable skill, it can be a peer support in this context. For self cannulation. Self cannulation can be important, and it can help new patients sort of get a sense of authenticity from those with lived experience, as well as from help from healthcare professionals, and also where quality of life more is is more um, there's sort of more validity, if you like, or more veracity around quality of life aspects, or those sort of paradigms that align to quality of life aspects, when in relating to peer support, there is by sharing aspects that bring a sense of uncertainty, or would tend to bring a sense of uncertainty to new patients. The quality of life aspects, as well, can potentially improve, rather than where in aspects of healthcare, in aspects of healthcare, at least retrospectively, new patients would almost feel as though they're getting from health professionals would feel that they're just getting a set of instructions, and so peer support in this context has advantage. Um, and also there's enhanced can prompt enhanced decision making going through sort of the sort of disease or condition pathway, and the sort of the disadvantages is that peer support on different forms or across renal replacement therapies um, uh, before 2015 were somewhat fragmented, mainly because peer support was in context of healthcare. It's been documented almost as a basis wherein to, wherein wherein uh, wherein for peer support to be successful, it had been evidenced and documented in some regard that there had to be a sense of funding, if you like, to certain aspects of the disease, of particular aspects of peer support and disease, um, and um, alongside this, experiences with um, alongside with this, in some regard, experiences with peer supporters have been described and evidence where for new patients, for example, unfortunately, there were have been documented and evidenced in the literature that the experience with peer supporters actually brought on higher levels of anxiety, or where anxiety was intensified, and and in some aspects, there have been documentation or evidence in works that there were that the communication skills were or had been sort of problematic, and where sort of new patients, for example, felt that they wanted to discuss or highlight sort of information that would be sensitive or semi-sensitive. um, uh, um, peer support uh, um, although in some aspects were adequate, at the same time, the 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 one of the one of the disadvantages around this also was that the understanding around peer support, or around a particular aspect of peer support, or where new patients are required understanding, there would be sort of a lack of in some regard there would be a lack of a lack of comprehensiveness in and around that particular experience, or in and around that particular aspect of healthcare. And so uh, and so um, and so it was and so in line with this, uh, I'm going to highlight some sort of overall conclusions around this what's been sort of highlighted, I guess. So public health supports individuals and organizations in context of society, preventing disease, um, and aspects that align to mortality and disability, and also long term health conditions. Peer support comes sort of uniquely or exquisitely with sort of experience or lived experience through practical through sort of sort of practical endeavor. Sort of strategies, sort of healthcare strategies through peer support can be advantageous, or have been identified as being advantageous and highlighted as sort of and have been highlighted in aligned to aspects of how sort of patients and health professionals sort of share sort of experience and technology, or at least online spaces and social media, for example, have a sort of an interplay around that as well. And the socio-ecological model is is an identifiable sort of inclusion a sort of focus set to include have been set to be included in sort of in aspects of public health. Communication as part of peer support is a sort of a primary focus on and is a primary focus, and generally important through various modalities of sort of the peer support dimension. And although there are some conflicting challenges of stigma, there has been some understanding or insights in the literature that shame has been highlighted when discussing particular aspects of condition and disease amongst new patients and understanding sort of the notion of how different cultures and communities influence one another still is research that is still required in some regard, according to and aligned to peer support. And peer support has generally been shown to be shown to be, or highlighted to be, sort of successful in that there are where there is peer support that has been successful, the peer support documented highlights in works where between aspects of peer support, the skills that are sort of shared, the skills that are highlighted and used or implemented are transferable, and enhance decision making, or part of the decision making in aligned to aspects of peer support can be can be and are generally important however, however, uh, in recent works, in a line to peer support and around this basis, there's works that had been published by for example, a team in the a Dutch team in 2017 that highlighted, for example, in and around sharing experiences, in and around sharing experiences, as well as identifying particular aspects that patients or carers and how aspects of healthcare aligned to particular themes. For example, in this works, the team identified it's not transparent, or it's not clear, that the way that through online spaces, or through for example, social media platforms, for example, it's not highlighted, or their works highlighted that it's not transparent, that the way for example, patients and carers, for example, the way that particular aspects of healthcare are shared, are not more often than not, at least in works by this Dutch team in 2017, highlighted that it's not clinically relevant to aspects of healthcare. And so it was in 2000 and 20 or 2021 or 2022, that Mohammed and team highlighted that through sort of after co-developing a sort of topic tagging activity through a successful between two successful social media platforms, again, in mentioning KDARS and the RPSG, in between the two social media platforms, and highlighted that that many of the members, or the service users between KDARS and the RPSG do have a lot of a lot of sort of experiences and understanding through the sharing of context through and between the social media platforms. What was different, and what came out of works by Mohammed and team, was that the way patients and carers versus how health professionals share understanding and experiences is where, for example, the way patients and carers share and view aspects of experiences, or lived experiences, are more often than not, not shared in a clinical manner, or using clinical, not always using particular coded based clinical terminology, which is what health professionals tend to be used to. And so therefore the works highlighted are highlighted as well, that are having developed co-developing sort of topic tag based themes, that help that patients and carers have a way of sharing clinical based context, aligned to chronic kidney disease, um, uh, wherein shared experience or experience is shared. However, patients and carers have their own way of sharing that experience, and at the same time, Mohammed and team, through the published works, also highlighted that, for example, um, though the experiences are shared differently and perhaps not in a non-coded, and shared in a sort of non-coded non-coded manner. At the same time, the clinical context that comes out of shared experience doesn't make it less important. Um, Patients and carers, at least in works that was published by Mohammed and team, highlighted that it was that patients and carers um, have do share context in a clinical language or clinical using clinical terminology. However, it's the clinical terminology, unfortunately, in context of healthcare, is not coded to the way, for example, health professionals code different aspects of terminology according to, for example, electronic patient records where they can be documented. Um, the works have been published, and the works around the renal patient support group, the RPSG, and KDARS, have been established since 2009 and 2014, and listeners are more than welcome to check out the works through the renal patient support group, the RPSG, or the kidney disease and renal support group, KDARS for kids. And so with this, I end this audio podcast. This has been an audio podcast aligned to the Illmatix series. This has been an RPSG and KDARS collaborative, an audio podcast on public health perspective on peer support. And once again, it's been another Storm Robotics production. Thank you.